Hello everybody, Dr. Shadi Rafich here, surgeon at TrueCare for Pets. This is Vet Talk. Let's pause for a minute. We're going to go into kind of a brief discussion about a veterinary topic that we've interacted with this week. And so for this topic, we're going to be talking about buyer's remorse. And what this is, if you're not familiar with that term, it's when you buy something, you spend money on something, a service or a product, and then you end up regretting it later on. And that's what we're going to be talking about today. And that may seem a little bit weird for folks who've never heard of it or have not had any issues, I guess, with veterinary care, to think, well, how does this relate to veterinary medicine? And it does actually. It happens a lot. A lot of people will justify the outcome of the pet and tie that into whether or not it was worth the money spent. And so you can say, well, okay, I'm willing to spend X number of dollars for a certain outcome. And that logic works in the majority of, I would say, services and merchandise purchases, but not in medicine. Human medicine and veterinary medicine doesn't work that way. So if you go to a store and you buy a product and it doesn't work to your satisfaction, or it breaks before it's supposed to break, beyond the warranty or whatever it is, you are allowed to and obligated to go back to the store and request a refund or exchange it for another product, right? If you go to get your car fixed by a mechanic and they say, yeah, we can fix this and it costs this much and it's going to take care of all your problems, and then the repair gets done, you pay for it, you take the car home, and within whatever within a very short period of time, it ends up coming back, the problem is recurring and it's an issue and the problem isn't solved, and you're going to go back and you're going to be like, hey, I spent this much to get this outcome, it didn't work that way, can we remedy this? And then they'll hopefully work out some sort of a deal or whatever it is, and try and revisit what happened, right? You expect there to be a positive outcome for the money spent in those scenarios. In medicine, because the outcome can be somewhat unpredictable, it's impossible to say, well, okay, I can guarantee you this outcome if you spend this much money. It doesn't work that way. It's never worked that way. It never will work that way. We do the best we can as doctors, for our clients and for our patients, to try and predict outcome. That's why we have medical research. Medical research, there's many goals to medical research, and one of them is to delineate prognostic factors, right? Prognosticators, prognostic indicators. These are factors that can help us as clinicians, when we're working up a specific case, try and predict what the outcome is going to be. So if, for example, a specific blood value on a blood work is abnormally elevated in your pet in association with a disease, well, we can look at the research and say, okay, in these dogs with this disease that have this elevation in blood work, it affects the outcome like this, positively or negatively, right? That's prognostic indication. If there's a certain finding that your pet has or that you have when you see your medical doctor, it may or may not affect your short-term and long-term prognosis. It may or may not affect your outcome with surgery or procedure or treatment. So we do the best we can with the information we have. We always combine our medical research with our own experiences to try and see what the prognosis is going to be. We can give you within reason a certain percentage. Let's say you've got a 90% chance of recovery, right? Well, there's 10% chance that things are not going to work out that way. Or we can say, well, no, the outcome should be pretty good. Understanding, of course, pretty good is not excellent. It's not perfect. It's not guaranteed. So you have to go into the profession, into the medical field, understanding that you may spend a certain amount of money to take care of your pet that has a certain disease and needs certain treatments or operations, and you will expect a certain outcome that may or may not actually occur. It's just the way it is. That's medicine. And it's unfortunate when the amount you put in doesn't equate to what you get out, right? I mean, we all want that. The more you put in, the more you get out. But in medicine, just doesn't work that way. If you spend a certain amount of money on a Ferrari, you're going to get what a Ferrari is meant to get you. If you spend a certain amount of money on a very old used car, well, you get what you pay for. It doesn't work that way in medicine. And so we frequently will see negative comments either online or word of mouth of people that said, I spent $10,000 and now I have a dead dog. Yeah, I mean, it's sad. Obviously, that's a concerning thing, but it's by no means the fault of the veterinarian. The amount of money you spend is supposed to be worthwhile, and the outcome is the best that we can try to achieve, but it's not always going to correlate. So pet owners and human patients alike need to understand this concept, because it's not going to change. As research progresses and we get more information, as we've been doing for many decades, and collecting the information, the data, we can make more educated, I'll say educated guesses for the outcome of a patient with a certain disease undergoing a certain treatment. But we're never going to be able to guarantee you anything. And even the most routine procedures can go awry, and even the most complex, multifactorial patients can succeed despite the odds, and everything in between. So just thought I'd share that with the community. Thanks so much for joining in. We'll see you in the next video. Take care.